Hey everyone, my name is Dr. Jeff Peng. This will be a quick 5-minute stretch routine to help provide relief for hip pain. I recommend doing this stretch routine 3 times a day in order to provide increased range of motion and increased mobility. Feel free to follow along as we go through all the stretches in real time. You can also use the timestamps or find a description of the routine down below. The first stretch we're going to do is cat-cow. So get on your hands and knees, wrists below your shoulders, knees below your chest, arch your back, try to touch that belly button into your spine and look down, and then rotate and look up. And we're going to alternate between these two movements, and we're going to do this for a total of 30 seconds. And this is a really good opener for our hips. It's going to help open up our spine, and just to get things moving. So we're going to do this for 30 seconds. 3, 2, 1. The next stretch we're going to do is we're going to work on our hip flexors. So grab some type of towel or a cushion or a pillow and put it underneath your knee. Put the other knee up in 90 degrees and you're going to lean forward. And you're going to feel a big stretch right here in the front of your hip right here. And this is where all your hip flexor muscles are. And you can try to just lean forward a little bit and you're going to feel that stretch right here. And we're going to hold this side for a total of 30 seconds and then we're going to switch sides. And this is really going to help open up the anterior portion or in front of our hips. So 3, 2, 1, good. Switch sides. So move your cushion to the other side. Put your other knee on it and then lean forward. It's just like this. Now when you're leaning forward, the more you lean forward, the more stretch you're going to do. If you want a bigger stretch, you can even arch your back backwards like this, and you're going to feel an even bigger stretch in the front of your hip where all your hip flexors are. So we're going to do this side for a total of 30 seconds as well. And in 3, in 2, in 1. Okay, good, 30 seconds. We're going to now move on to our quadriceps muscles. So take that same towel and just like in that hip flexor position, we're going to have our knee up like this. This time, grab your heel and try to pull it towards your glutes, just like this. And you're going to feel a big stretch in the front of your thigh muscles in your quadriceps over here. Now it's important to stretch these muscles out because part of your quadriceps actually attaches to your hip, and when these muscles get tight, it tends to rotate your pelvis forwards. Now if you have stability problems, you can grab on and hold on to maybe a chair. Okay, 30 seconds, we're going to switch sides. And pull your heel up and try to feel that stretch. Now if you can't get your heel all the way up here and it's down here, that's fine. As long as you're feeling a stretch in the front of your thigh muscles where your quadriceps are, that's the goal. But the more you get your heel towards your glutes, you're going to get a bigger stretch in your quadricep muscles. And stretching out these quadriceps are so important in preventing and treating hip pain. So 30 seconds in 3, 2, 1, good. We're going to move on into our hamstrings. So extend your leg and then lean forward. And if you can, try to touch your toes. You can do that. Otherwise, lean forward with your chest, hinge at the hips, and try to touch your chest into your knee. And what you're trying to do is you're trying to feel a big stretch in your posterior thigh where all your big hamstring muscles are. And so what we're trying to do with this routine is we're just trying to stretch out all the muscles in the front of the hip or where the thigh is, in the back of the hip where our hamstrings are. We're going to move on into our glutes or the posterior thigh. And we're going to do this side for 30 seconds. In 3, 2, 1, good. Switch sides. And lean forward. And tight hamstrings, what happens is when your hamstrings are too tight, it tends to rotate your pelvis backwards. And we call that a posterior pelvic tilt. And really our pelvis just needs to be neutral. If you're tilting forward, if you're tilting backward, that changes your posture, that changes your gait, that changes how you move. And that's what leads to, back problems, it leads to hip problems, and that's why mobility is so important. So 30 seconds on this side. Good. Now we're going to move into glute stretch. So 2 ways of doing this. We're going to do 90-90 or a pigeon pose. So 90-90 is 90 degrees here, 90 degrees here, lean forward just like this. And you're going to feel it in the posterior part of your hips where your gluteal muscles are. Now, what you're trying to do is you're just trying to lean forward and try to touch your chest towards the ground. And the more you can do it, the bigger stretch that you feel. And just like all our other muscles, our glutes are incredibly important for pelvic stability. And so tight glutes, weak glutes tends to affect posture, tends to affect movement, and all of that will result in hip pain. So good, 30 seconds, we're going to switch sides. So this time I'm going to show you a pigeon pose. So same thing, 90 degrees here, but this time extend your leg backwards and then lean forwards, just like this. And if you can't get all the way down, you can start up with your hands up here, and even here you should be able to feel a tight, or I should say a big stretch in the posterior part of your glutes. And if you can lean forward, try to get onto your forearms for an even bigger stretch. And this is so important for people who have posterior hip pain. This stretch is really good in stretching out all those tight glute muscles. So 30 seconds. So the next stretch we're going to do is something called the butterfly stretch. So sit like this, try to touch your feet together, open up the knees, and lean forward. And what this is doing is really help opening up and stretching out the groin. So all your adductor muscles in the inner part of your thigh comes in and inserts onto your pelvic bone. And sometimes that can get really tight. And so what you want to do is try to relax your knees all the way down and lean forward to try to get a bigger stretch. I'm going to hold this for 30 seconds. In 3, 2, 1. All it takes is 5 minutes to stretch out the hips. Do this routine 3 times a day in order to provide relief for your hip pain. If you found this information useful, please share with others. Please also like the video and consider subscribing to my channel. I can be found on Twitter at Peng MD, and I also write on my blog at jeffreypengmd.com.